Brittany, thanks so much. 8:47 is your time. Sinusitis affects some 35 million Americans, but a new procedure promises to open those sinus pathways, giving you immediate relief. It's called the Sinus Balloon. ENT specialist Dr. Knox is here to show us how it works. Good morning.
Good morning.
This is very interesting because I know, obviously, 35 million people. There are a lot of people that suffer from this. Let's talk about sinusitis and explain what it is, because those who may not know are curious.
Sure. Sinusitis is inflammation of the mucous membranes of the sinuses, which causes swelling and blocks the sinus openings, which causes a variety of symptoms, anywhere from fever to headaches, congestion, nasal drainage, fatigue.
Is it associated with allergies at all? I mean, is this a seasonal thing, or it's something that can, happen any time of the year?
Well, it can actually be either and or. About 80% of people with chronic sinus infections have allergies playing a role, so allergies are a significant factor. But certainly people without allergies can have sinusitis as well.
All right, so this balloon, this new technique, this new procedure, how does it work?
The balloon is a minimally invasive procedure that we can now perform in the office. So instead of going to the operating room under general anesthesia, we can do this under local anesthesia. Patients experience pretty immediate improvement in their symptoms and can typically go to work the next day.
You brought an example. So this is actually how you do it? This is the actual device you use?
This is the device we use.
Okay.
What we do is we numb the inside of the nose, and we're able to pass this through the nose into the sinus opening.
So how far does that actually go in then? I mean, pretty far?
The tip of the device goes into the sinus opening. Okay. And then once we confirm that with the light that you can see,
I see the light.
Through the
end,
we
can see that clearly.
We can also see the tip through our scopes in the office. Once we do that, we thread this catheter over the guide and then inflate the balloon with saline.
Now, is that painful? I mean, are they going to feel something during or after for a little while? Some soreness, some irritation?
Typically, patients will feel maybe a slight bit of pressure. We're not removing tissue, so discomfort is really very minimal. And by the time we're done, patients get immediate relief of their symptoms and really have minimal discomfort. And
how long will this last then for them?
Well, the effectiveness is about 98%. In other words, 98% of the people do well long term. So the results are very good.
Who can do, I mean, is there any limitations on who can have this procedure done?
Well, it's typically for people who have failed medical therapy, who have chronic sinus infections and just don't get better with medicines, or people that have multiple infections per year and require antibiotics frequently. Then this is a good procedure and hopefully minimize their medication use.
Is it approved for children as well, or is this mainly for adults?
Mainly for adults.
Yeah,
you have to be a little selective with that.
All right, for people who are curious about this, because I know so many people do suffer from sinusitis, so where can they get more information? You have a website?
There's a website, sinussurgeryoptions.com.
You have it there on your screen. Doctor, thanks so much. Fascinating stuff. New technology and new relief for patients out there. Nice to meet you. Thanks so much.
You.
Let's toss it over to Craig now.
All right, still ahead this morning,